North Belfast experiences some of the most chronic and long-standing deprivation and inequality in Northern Ireland, and the situation is exacerbated by the fact that it is an area which was most affected during the decades of conflict that happened on this island. Now, despite extensive governmental initiatives and programmes, government's own statistics evidence the fact that these patterns of inequality and deprivation remain unchanged. The participation in the Practice of Rights project is working to show how international human rights standards can be used by marginalised communities and groups to, on the one hand, improve the way public services are delivered, but most fundamentally to improve the way government decisions are made. We work to support groups by giving them the tools and resources they need to use a human rights-based approach to campaign for improvement around social and economic issues such as housing, education, mental health and employment.
Since 2007, the PPR Project has worked with groups to develop human rights indicators and benchmarks to measure whether their rights are being made real by government in a way that is evident on the ground. People affected by housing problems such as sewage overflow in baths and pigeon waste on the landings of their flats have set human rights indicators and benchmarks to measure whether progressive realisation of their rights is taking place. Through doing this, they have learned that these everyday issues affecting their lives are also human rights issues. So while the groups measured whether sewage problems were resolved and pigeon waste cleaned, they also measured whether government agencies were doing what they were required to do to fulfil human rights standards. However, the groups have realised that in order to make changes on the ground last, the way that services are delivered to communities had to change. People who were affected had to be involved in all aspects of decision-making processes that impacted on their lives.
So the groups the PPR Project works with try to take core human rights values of participation and accountability and turn them into operational principles for decision-making processes. One such group that we work with is the Belfast Mental Health Rights Group.
People who presented to Causeway out of ours with deliberate self-harm, they weren't able
In
to
2009, the Belfast Mental Health Rights Group campaigned for a new hospital appointment system for people at risk of suicide and self-harm. To ensure that the new system was effective, the group fought for a seat on the Public Implementation Board. Many members of the groups have been involved in consultation or participation boards and structures that they felt had not achieved anything.
The good points would have been, well, at least we've got these people here, but are we going to get any results, positive results from this? Because you don't always. Promises are made, but promises don't always be kept.
Whenever you went in the room, what you were going to say, it was filtered away by the time you left and you were none the wiser.
They were speaking, as I said before, in a language that I didn't understand, so I need to know in layman's language what they're talking about, not in fancy words that I personally can't understand.
Using these experiences and the human rights standards around participation, the group developed a set of indicators to measure whether their participation was being properly facilitated in line with human rights standards. In other words, was it meaningful? The group themselves have defined what this means in practical terms. For example, that they were involved in setting the board's terms of reference and ensuring that information was presented to them in an accessible format. These were small steps that the group felt would help to measure whether participation was actually shaping decisions. Challenges remain for the Belfast Mental Health Rights Group and their work to implement the new appointment system. The new policy needs to be monitored to make sure that those in most need of mental health treatment remain effectively tied into services when they are at their most vulnerable.
The experience of the Belfast Mental Health Rights Group is common to all the groups that we work with. Had they not sought to claim and enforce their rights, then the change that they did achieve, the new appointment system, would not have been possible. So all the groups that we work with use a variety of human rights tools, be it indicators and benchmarks or budget analysis or even freedom of information requests, to enforce their rights, to create positive changes within their community, but most importantly to create new forms of governance that are capable of bringing about social and economic progress.